Good afternoon. I'm Dr.Deepti Challa, and here we have our esteemed guest all the way from Genoa, Italy, Dr. Marco, whose specialty happens to be pediatric rheumatology and autoinflammatory conditions. Hello, Dr. Marco.
Hello.
So, Dr. Marco, is this your first time to India or have you been here before?
This is my second time. I'm always very happy to come back to India, and this experience was even better than the first one. So I want to come for the third one.
Oh, lovely. So, have you been to visit some places across the city?
Yeah, had the possibility to visit some hotspots like
Charminar.
yes, and Golden Fort
Oh, no.
are fantastic. So I had the pleasure to see the flavor of India and also to taste the fantastic food.
Oh, I'm glad you liked
Thank
it.
you very much.
So, Dr. Marco, I know that your specialty concerns pediatric rheumatology and autoinflammatory conditions. So, can you please tell me more about your work?
Yes, of course. In general, we have a very big center for pediatric rheumatology. We host a large network that is the Printo network. That is a network that is born to collect centers around the world to perform clinical trials in pediatric rheumatology. You know that is a rare condition in children, so to afford the possibility to make a clinical trial in childhood, you need to have a huge collaboration. That's what we are doing in Genoa, together with a huge clinic of pediatric rheumatology. And now since 15 years now, 20 years now, I have to say, we are setting up also a big clinic for autoinflammatory disease with our geneticists. That is one of the most relevant part of my personal involvement in pediatric rheumatology now.
So, Dr. Marco, autoinflammatory conditions still are a very gray area in both diagnosing and the management. Can you please elaborate more about the role of genetics, which could play a part?
Yeah. So I think that this is one of the most exciting novelties that we have in the field of inflammation and the field of rheumatology. The idea that there are monogenic diseases that are linked to an inflammatory phenotype. Of course, this seems to be a thing that is more related to the pediatric part, because the genetic disease usually occur in the pediatric age. But I think that this is quite relevant also for adult rheumatologists. Now we have a number of conditions that pertain to adult rheumatologists. I think about VEXAS, that is a new monogenic condition in autoinflammatory disease that may mimic a lot of other conditions and that can occur in adulthood. So I think that I'm pretty sure that even in adult rheumatologists, we will see a lot of new conditions that are pertinent to the gene mutation. And I think this is something that is in a way revolutionary, because if we understand the genetic molecular mechanism of different conditions that give inflammation, we can learn a lot of things about how the inflammation is regulated, not only in rare conditions, but also in very frequent multifactorial conditions like autoimmune disease, lupus, or arthritis, and so on.
So, Dr. Marco, we do know that rheumatology itself is a very up-and-coming and a very young subject. And in that, the realm of autoinflammatory conditions is still new. Can you please tell me any advances or anything you felt were significant in the last 5 years or the last decade? Significant advances which could have propelled this autoinflammatory conditions onto the front stage.
Yeah, I think that knowing the example of an NLRP3 inflammasome, of course, is quite important. Is before of 5 years ago, but I mean it's an example of how the knowledge of a molecular mechanism that was explored thanks to the presence of genetic diseases. How us to understand a lot of mechanisms related to the activation of the inflammasome and the role of IL-1 in many different conditions, like, for example, gout, or even by the ischemic infarction and so on. So this is quite relevant. And now new stuff are coming, especially for example, for the old interferonopathies all the diseases that are related to a genetic overactivation of type 1 interferon that can teach a lot about lupus and dermatomyositis and different mechanisms that we observe in multifactorial disease. And then also, again, we can use and target with small molecules that are linked to protein kinase, J kinase, but also other kinases. There are plenty of kinases, and there are more and more genetic diseases that are linked to a gain of function of some protein kinases. So I will see in the future more and more diseases that are linked to a proper disactivation or dysregulation of a mechanism or pro-inflammatory mechanism that we can target with precise small molecules.
So in the next 10 years, hope this comes through where we have a more targeted approach to our management.
And that we can, a mutual, let's say, a mutual help with hematologists and oncologists, because I understand that we are now looking to the same molecules that are dealing with some immune cells, but also with lymphoproliferation and so on. So the mechanisms are sometimes the same.
We need a more multidisciplinary approach to treating these conditions and going forward.
I think that is very fascinating.
So what do you expect from the younger generation of rheumatologists? Where do you want them to carry forward the mantle of work that you have done so far?
I think that what I would love if they go into deep in this pathogenic mechanism, in the molecular analysis of our patient, to be able enough to have even more targeted treatment. So not to be scared to go into biologic, go to molecular analysis, because I think even for multifactorial disease, because I've learned from the biologic era how the knowledge of the molecular mechanism can help the patient to have better drugs, maybe less costly, but effective, with this concept of precise medicine that is applicable, in my opinion, also in rheumatology.
The targeted approach is what you're looking going forward.
Yes. And also, I have to say that the story of, let's say, playing with the cells, the story of CAR T cells in lupus, for example, seems to be quite promising. We have to see what is going on, but I think that our young colleague, as you are, will be the possibility. We have the possibility to have a great future. I'm quite optimistic on that.
So, Dr. Marco, are you enjoying the scientific program of this IRACON 2023?
Yes, absolutely. It's very, very, very high level. I see a lot of very, very fantastic presentation, not only for the foreign guests, but also from the Indian colleague that have a very, very good level of science. So I was really, really impressed. So congratulations for IRACON.
Thank you. So on a lighter note, to conclude, Dr. Marco, you are a very busy man and you are quite eminent in your research and in your field of work. How do you take time out to do the things you love, for your passions and your hobbies? Something for work balance, for any suggestions?
So, I love playing tennis, and I play almost every day, but however, I need to go at the tennis court at 6:30 to have enough time to play and then to work. And then I try to hike every weekend or during the summer, because of what I like is hiking and go around on the Italian Alps that are beautiful. You have to come.
Definitely. So you like to keep fit to make sure that your patients stay fit?
Yes, I try to at least.
So I know you're an Italian, so I'm going to ask you a very controversial question. Do you like pasta or pizza more?
Oh my God, it's so difficult. It's like if you like more your mama or your papa. But however, I have to say pasta, because pasta is so different in Italy. You know, there are thousands of kinds of pasta, but I really love Indian food.
Oh, thank you so much, Dr. Marco. Thank you for this lovely interview.
Thank you.